International Volunteer Day was recognized earlier this week. Allison and Neetasha are volunteer coordinators with Niagara Health. Our hospitals offer many opportunities for people to get involved. And Allison, how many volunteers do we have in total with Niagara Health?
So right now in total, our team of volunteers sits around 600 people.
Wow.
Yeah.
What kind of opportunities are there? Where do these volunteers contribute?
Pretty much anywhere and everywhere. We have volunteers at the main entrance of the hospital. We have volunteers anywhere into the intensive care unit or some of our specialty clinics. Anywhere there's an opportunity to offer support in the patient experience, we like to have volunteers there.
Neetasha, what kind of person typically volunteers? Or is it someone with, I guess, experience in the medical system, either as a patient or as someone who may have worked in the medical system and is retired?
Yeah, so I mean, there's no experience that is specifically required to volunteer in the hospital, but a lot of volunteers that we'll get are people who may have come in as a patient or were with a loved one and they want to give back to the community. We also have students that come in to kind of gain some practical experience as well that want to volunteer, and it kind of helps them shape what they want to do as well. But yeah, so there's no specific experience required, but yeah.
But lots of training, right?
Yes.
Because they need to be trained and they also need to be screened before
Yes.
you take them in. What's that process?
So it's a normal interview process. We refer our volunteers to apply online through the Niagara Health website, and then we screen them as prospects, bring them in for an interview, and then after they've been selected as a successful applicant, they'll go through our regular orientation, and then we do have a thorough medical process before volunteers are able to step foot on site, and then after that, we do place them in positions that are available at the hospital.
And Allison, is there an opportunity to try and match what their interest is usually?
Absolutely. It's really important that we recognize the tremendous value that volunteers bring to the hospital, and we want to make sure that volunteers feel valued and that they're able to contribute in ways that are meaningful to them. So, you know, we always say to our volunteers, we want this to benefit you as much as it's benefiting the hospital, so we work really closely with them to find that fit where they can be their best self.
I understand the auxiliary at the St. Catherine's Hospital is the oldest. Is it the oldest in Canada?
The oldest in Canada.
That's amazing.
It is amazing.
They've really
Yeah.
set the standard that other hospital systems have followed?
Yeah, so we now have, so St. Catherine's was the first hospital auxiliary, and we now have 5 hospital auxiliaries in Niagara supporting each one of our hospital sites.
Wow.
So they've done some really tremendous work there.
I know you take volunteers in at the Walker Family Cancer Center. How are they helpful there?
They are, such an asset to the team. And what's really unique about our members of that volunteer team is that a lot of them have specific experiences that encourage them to volunteer. So they get it. They know what it's like. They've been on the other side of things, and they can offer that comfort and compassion and make people feel like a person and not a patient.
Many of them have suffered from cancer, fought cancer, or maybe had a family member.
They've experienced it in some way, shape, or form. Yeah.
Neetasha, Med Plus that's a program that works with Brock University?
Yeah.
And you take volunteers in for that as well?
Yeah, so every year we go through a process where we'll go on site at Brock University, we'll interview students who are in the Med Plus program who want to be getting that experience on site as well. So we'll put them, a lot of them do go into the emergency department. That's where they prefer to go to get some experience and see different things. It's also a department where there's a lot of flow of people incoming and outgoing. So they get to witness a lot of different things there. But they will be placed in other areas like the fracture clinic, which is also pretty hands-on experiences. They get to look at x-rays and be a part of cast removals and such. But there's multiple placements that happen around the 5 sites and at the different hospitals when it comes to Med Plus.
Allison, you have volunteers of all ages. I'm hearing you say high school students often will volunteer. Neetasha was talking about Brock students, and I know there's a lot of seniors that give back. Is there an average age of the volunteer at the Niagara Health?
It's hard to say because our team is so diverse, and we encourage that and we foster that. It's really important that our team reflects the community and that people, when they come to the hospital, they can see themselves in a volunteer.
Does that mean too that you're looking for people that can speak some other languages to help some of the patients?
Absolutely, yeah. We're looking for volunteers from sort of all walks of life. Basically, if you are comfortable in a hospital environment and you're interested in giving back or helping others, we likely have a spot for you.
Neetasha, is there a specific intake date? I know we're approaching the end of 2023. Are you looking for more volunteers to maybe make this their New Year's resolution?
Yeah, no, Niagara Health is always looking for volunteers, especially coming back post-pandemic. So obviously with Christmas approaching, it's kind of a bit on hold. However, spring of 2024, we're looking to intake a lot more volunteers again. And we're trying to focus mainly at the Niagara Falls site and the Welland site. But yeah, we're always welcoming volunteers.
How can people find the information and I guess the links to start the application process?
Yeah, the best way is to start online. We have a page on our website that is dedicated just to volunteers. We share information, we post information there. Also, we have a really great communications team at Niagara Health that's great at social media, sharing about volunteers and opportunities. So basically, if you Google us, you can find us, and if not, then just give us a call.
Allison, Neetasha, thanks so much for joining us today.
Thank you.